The Sierra Leone Association of Social Workers, we are the professional body of social workers in Salone. Your work, amongst other things, and follow advocate for the welfare of we membership, social workers, practitioners, graduates, and others. And we think we cannot adequately do that if we do not know who are the social workers in day. And additional to that, we also feel there will be need for letting get resource mobilization and resource allocation within the state. And until we know the practice areas of the social workers there, it cannot be successful and also they are located. So that's amongst other reasons why we think we need to get a comprehensive database of social workers in the country. We know their practice capabilities and capacities and where they can be located. And within the areas of standing, because that's what professionalism requires.
So that now this particular data issue, you think is one of the biggest challenge we the association don't get so far?
So we feel you not go able to plan properly if you do not have an accurate data. Most times there are these assumptions to say, well, the people when they practice social work, they actually not get the academic credentials or they practice social work, or there are those who will get the academic credentials, but they are not employed rightly, or at the right, they're not put in at the right position for making them do the work. But all of these things are assumptions. When you go to the Ministry of Social Welfare with the overseas social welfare and social work practice in the country, the amount of people that within they employ most likely not go reach the one they wish on non-governmental organizations then they employ. And the kind of people that we go there amongst the institutions there so may not necessarily have what you call the academic credentials for we should see they actually don't go through the work or through the training we require for me to be a social worker. All of these things are assumptions, and we think we need to get empirical evidence for we make arguments towards standing.
So when this particular census starts?
So the census starts, it already starts from the 1st of September, but they run up to the 23rd of September. That's for the in-person.
Okay.
As to the updating of the data, that's why we decided to make a hybrid version. We'll get the in-person, then we'll get the online registration. The online registration in a continuous process, so it means that people can always have to get us informed when once they can within the space of social work as credentials. So it's running up to this month, but actively we think we'll get during the course of September and make sure we get the results we want.
So how the census get for good like and other than get for participate, just like we make mention earlier, you say on want for get some kind of data we will for informed decision the way go help for address social work issue and the social worker themselves. And you just make mention say you're not go able for do that if you're not able for get the actual people within into this particular space. So how now go able for identify them people in there for the part of the census, how they go for participate when you not know them?
So the association, Sierra Leone Association of Social Workers, they collaborate with the Ministry of Social Welfare for this activity. And the good thing is we get support from UNICEF for we carry this particular thing out. So it gets for be cut across the country. And the criteria for participate one, it's either you are a social work graduate, it can be a certificate in social work, diploma in social work, bachelor's in social work, master's or PhD in social work, or there has been this set of people we don't practice before the academic area of social work coming.
Okay.
We also want for banking on the experience and know whether there is a need for we advocate for further continuous professional development of the one that we don't get a vast experience. So we no want for restrict to say now only way you don't get people in social work. So there are these people who only practice. So if you're a practitioner in social work but may not have been a graduate in social work, you are also encouraged for participate into this. So then in itself, they make a decision as to how would we advocate for advanced studies or continuous professional development.
Okay, so this census same way so they seek for collect vital data as we for inform the development of policy them. So which kind of policy then?
So sometimes we admire countries that we already would call developed countries, but we still not able to pay attention how they reach that particular side as developed states. But we check through the history, you will find out within the development agenda, then put social work as one of the things them we therefore use for get developed. And they like to really admire them. Unfortunately, we don't give that as priority as a country in Sierra Leone. And when you check, and evidence of that, when you check when there are budget allocations to ministries, Ministry of Social Welfare, they get one of the list. But when you check their mandates, they get one of the broadest mandates.
Okay.
So we think say, maybe the development trajectory within the country not see the need for social work because they are not informed on waiting in mean forget social work as part of the development agenda. So we think say if we are to make that argument, we first and foremost need to be sure so we get the manpower or get the capacity for let we get manpower at the end of the day.
Okay.
All right. So amongst other things, we think that this vital data collection gets to give we a holistic view of how we get to make those advocacies for like social work be as part of the development agenda of the country.
Okay, so this particular census get for end on the 23rd of September. So after the census, they'll end with next.
So after the census will end, we get reason for let we analyze data and let we know first and foremost waiting at the distribution of practice interest within the social work. Because there are so many social issues in the country. You have child protection, you have mental health and clinical social work we needed in the country. You get school social work when necessary. You get sexual and gender-based violence area of practice where people them need to know how many people then they will get we needed in that particular direction.
Okay.
We get community development. We get so many practice areas. So we get to analyze all of the data and then we try to get communication with we supervise the ministry or the collaborate with in our Ministry of Social Welfare. We get them from, you want to cover the civil society angle. It's from a civil society perspective. What is it that they need for get informed? So if they self get for make arguments at cabinet level or at government level, they also get to get that way for let them argue that out. Again, there are non-governmental organizations we go want for can make interventions on social issues, but they would need this information. And the information they also therefore make them available to them when once they make a request for that. And we think say one way or the other, every other citizen of this country go benefit from this particular data because the end goal now for enhance the welfare and well-being of citizens of this country.